good morning. I'm talking with Ellen Kornfeld today. Ellen is a narrative therapist, a nutritional counselor, and food coach. Hi, Ellen. How are you?
Good morning, Joanne. Good to talk to you.
Lovely to talk to you too. Ellen, you've worked a lot with eating disorders. Can you tell me what is an eating disorder?
Well, I don't like to use the word eating disorder. I'm more comfortable with disordered eating because that encompasses a lot more than the words that are being thrown out in the press. And I like to think that when I use that big term, I'm embracing a lot more than anorexia or bulimia. So let's try and use the words disordered eating. Okay, disordered eating. Eating is something essential for life. It's something pleasurable. It's something that brings people together and makes us healthy. It says we care about ourselves, and it says we care about life. When we might not be feeling okay with ourselves, when our environment, both external and internal, might be showing signs of I'm not comfortable with myself, we pick up behavior, not only in the eating realm. We pick up alcohol, we pick up compulsive chewing gum, we pick up drugs, etc. Food is one of those things that we can use in the negative. When we start to develop, or we see the beginning of something developing that says, this person isn't comfortable eating, that is the beginning of disordered eating. Everyone that I work with over 25 years tiptoes into disordered eating from a different place. We might have the medical experts saying they do this, they do this, they go in and stick their fingers down their throat. These are all the symptoms, but each person that I see and share conversations with brings me a lifetime of a story. And why a particular person uses foods, everybody is different. Food is available, and we're very intimate with it. So very often foods are something that we do abuse. So that's a little bit about disordered eating.
And as a narrative therapist, how would you deal with somebody who came to you with disordered eating? Most people go to a conventional, psychotherapist or psychiatrist. How does narrative therapy work?
Okay. That's such a good question. Perhaps to just stop for a minute and how do people come to me? Most of the time, they have been through conventional therapy. Many times, they have been hospitalized, more than one time. And yes, they might have an IV, and their weight comes back up. But the why, the story, they're not always dealt with because these words don't have time. So coming and having a narrative conversation with me, very often they mention what's going on with their eating if they're comfortable enough to in the beginning, but we might not really talk about they're purging or they're binging for a while. We're talking about what's going on in their lives. I collaborate with them. I hear their stories. They are an expert on what they're talking about. When they do tell me stories that might be considered problems in their lives, we might explore, as I do with any other client that doesn't come to me in the food realm. Have you ever had a time when you didn't do this problematic behavior? And they might tell me a story, and I'll ask them how they managed to not purge that one time. They might tell me a story about being in a place they're feeling good about themselves, having a conversation, being in non-threatening places. And so we try and move out of this very down story that they're finding themselves in and move to these sparkling places of positive defiance, saying no to purging. It's not easy. It's not 1, 2, 3, as my client said. This is not abracadabra. But I join with them. And when we see sparkling moments, when someone disordered eating is accompanied by a comfortable routine that people work out for themselves, secret eating, staying away more and more from their friends, which might have led a parent to say, go talk to me. When they bring me stories that they went clothes shopping and they bought something fitted, when they tell me they called up old friends and they sit with them, when they go and they can say to me, I didn't plan my purge. These are the steps that are called progress. Parents, schools, friends, they need to be alerted, and that's good, but we need to know to watch for her kind of progress. What do you mean she's been coming to you for 4 months? She's still purging, right? When we look for those sparkling moments, that's progress. So I value their story. I talk about their story as the problem, not them as the problem. And we work with hope. We try and move out of the story of despair. Can you imagine living like this for 15 years in secrecy and to be able to talk about it? So we create safe places to share and to make differences. What I encourage the people I work with is just like we go out on the street and the same cars are there, or the same stress from work, or the same relationship that causes us deep pain, those things don't go away. But how we deal with them, how we can finally say, I can have a conversation with this person and let them know what I'm about instead of retreating to the cookie jar at 12 o'clock or purging as my answer. That's what we build together.
Ellen, and just a quick final question before we go. You, as a narrative therapist, work in Israel. If somebody watching this interview wants to find a narrative therapist, are there narrative therapists working in other places in the world?
Yes. I do work internationally on Skype. There are narrative therapists. I will tell you, in my office, I'm the only one who will work with it. People are afraid to work with it. So I'd have to do a little bit of investigating abroad who I would suggest. But I'd certainly have a narrative, respectful, embracing conversation with family or the clients themselves on the topic, on the phone.
Thank you, Ellen. Thank you so much for sharing that information today.
Thank you.